Good afternoon, everybody. Again, this is Conlin Tabor, and our title or our topic is all about the speed up access to COVID-19 tests, medicines, and vaccines. A top priority in 2021 will be to continue our work across the four pillars of the ACT or ACT Accelerator. So targets include distributing 2 billion vaccines and 245 million treatments, establishing testing for 500 million people in low and middle income countries, and strengthening the health systems needed to support them.
Good day everyone, I am Marvic Gulbin-Astillero and this is our problem statement and shared review of our title, Speed Up Access to COVID-19 Test, Medicines, and Vaccines. Problem statement. First, why does a certain group must be prioritized to be vaccinated? Second, why does the test of vaccination and other tools need to speed up against COVID-19? Shared review. So the world is facing serious issues due to COVID-19 pandemic. Billions of people around the world who were investing their hopes in a safe COVID test, effective medicines, and vaccines. We remain vigilant to protect our families and communities from COVID-19. Some people might be tempted to buy or use questionable products that claim to help diagnose, treat, cure, and even prevent coronavirus diseases. The FDA continues to work with the vaccine and drug manufacturers, developers, and researchers to help facilitate the development and availability of a medical product such as additional vaccines, antibodies, and medicines to prevent or treat COVID-19.
Hey everyone, I'm Joanne Miyabi-Trigo. So today I'm going to tell you the step 4, which is to conduct review for situational analysis. So the step 4, conduct a review. So heads of state and global health leaders today made an unprecedented commitment to work together to accelerate the development and production of new vaccines, tests, and treatments for COVID-19 and ensure equitable access worldwide. So the COVID-19 pandemic has already affected more than 2.4 million people, killing over 160,000. World Health Organization has been with researchers from hundreds of institutions to develop and test vaccines, standardized assays, and standardized regulatory approaches on innovative trial designs and defined criteria to prioritize vaccine candidates. So the challenge is to speed up and harmonize process to ensure that once products are deemed safe and effective, they can be brought to the billions of people in the world who need them. So Dr. Tedros said, our shared commitment is to ensure all people have access to all the tools to prevent, detect, treat, and defeat COVID-19. And no country and no organization can do this alone. The Access to COVID-19 Tools Accelerator brings together the combined power of several organizations to work with speed and scale. So in another blow, the pandemic threatens to set back hard-won global health progress achieved over the past 2 decades in fighting infectious disease. For example, and improving maternal and child health. So in 2021, countries around the world will need to continue in battling COVID-19, that they will need to move swiftly to repair and reinforce their health system so they can deliver these tools and to address the key societal and environmental issues that result in some sections of the population suffering so much than others. COVID-19 has been a pivotal moment in many ways and offers a unique opportunity to build back a better, greener, and healthier world. Our manifesto for a healthy recovery from COVID-19, with its goals of addressing climate change and health, reducing air pollution, and improving air quality, can play a major role in making this happen. So one of the key principles with the World Health Organization has emphasized throughout the fight against COVID-19 is the need to demonstrate greater solidarity between nations, institutions, communities, and individuals closing to the cracks in our defense on which the virus thrives.
Step 5. The scope of the review. This step focuses on answering the two questions, which is the speed of access in test of vaccinations, which tool needs against COVID-19, and the reasons why certain groups are prioritized to be vaccinated worldwide. The Access to COVID-19 Tools or ACT Accelerator is a groundbreaking global collaboration to accelerate development, production, and equitable access to COVID-19 tests, treatments, and vaccines. Launched at the end of April 2020 at an event co-hosted by the Director General of the World Health Organization, the President of France, the President of the European Commission, and the Bill and Melinda Gates Foundation. The Access to COVID-19 Tools or ACT Accelerator brings together governments, scientists, businesses, civil society, and philanthropists and global health organizations, the Bill and Melinda Gates Foundation, CEPI, FIND, Gavi, the Global Fund, UNITAID Welcome, the World Health Organization, and the World Bank. Following the ACT Accelerator launch, UNICEF and PAHO became delivery partners for the COVAX, the vaccines pillar. These organizations have joined forces to speed up an end to the pandemic by supporting the development and equitable distribution of the tests, treatments, and vaccines. The world needs to reduce mortality and severe disease, restoring full societal and economic activity globally in the near term, and facilitating high-level control of COVID-19 disease in the medium term. The World Health Organization surge calculators to gauge the need for supplies, equipments, and health workforce requirements during the COVID-19 pandemic, who has developed a suite of complementary surge calculators, one for supplies and two for health workforce. All tools use the same base epidemiologic assumptions and classify health workforce using standardized International Labor Organization International Standard Classification of Occupations codes, but their outputs are intentionally different due to their primary focus. The World Health Organization COVID-19 Essential Supplies Forecasting Tool, or the ESFT, is designed to help governments, partners, and other stakeholders to estimate potential requirements for essential supplies to respond to the current pandemic of COVID-19. Although it provides an estimation of the number of cases, this calculator is not an epidemiological calculator. The focus of this tool is to forecast essential supplies. It includes estimation of personal protective equipment, diagnostic equipment, biomedical equipment for case management, essential drugs for supportive care, and consumable medical supplies. So the second one is the certain groups are prioritized to be vaccinated since they are the people who have higher risk or most commonly high percentage of being infected of COVID-19. Older adults are at higher risk of getting very sick from COVID-19. More than 81% of COVID-19 deaths occur in people over age 65. The number of deaths among people over age 65 is 97 times higher than the number of deaths among people ages 18 to 29 years. A person's risk of severe illness from COVID-19 increases as the number of underlying medical conditions they have increases. Some people are at increased risk of getting very sick or dying from COVID-19 because of where they live or work, or because they can get health care. This includes many people from racial and ethnic minority groups and people with disabilities. Studies have shown people from racial and ethnic minority groups are also dying from COVID-19 at younger ages.
People in racial and ethnic minority groups are often younger when they develop chronic medical conditions and may be more likely to have more than one medical conditions. People with disabilities are more likely than those without disabilities to have chronic health conditions, live in shared group, also called congregate, settings, and face more barriers in accessing health care. Studies have shown that some people with certain disabilities are more likely to get COVID-19 and have worse outcomes.
Step 6. Equitable access to safe and effective vaccines is critical to ending the COVID-19 pandemic. So, it is hugely encouraging to see how many vaccines proving and going into development. WHO, or World Health Organization, is working tirelessly with partners to develop, manufacture, and deploy safe and effective vaccines. Safe and effective vaccines are a game-changing tool, but for the foreseeable future, we must continue wearing masks, cleaning our hands, ensuring good ventilation indoors, physical distancing, and avoiding crowds. Step 7. Vaccine Effectiveness and Impact Document provides interim best practice guidance on how to assess COVID-19 vaccine effectiveness, VE, using observational study designs. It discusses critical considerations in the design, analysis, and interpretation of COVID-19 VE evaluations, as biased results may be produced even in settings where data completeness and quality are high. This guidance is targeted mostly for evaluations undertaken in low and middle income countries, but most of the concepts apply to VE evaluations in high income settings as well. Due to their methodological complexity and susceptibility to biases, COVID-19 VE evaluations do not need to be conducted by all countries introducing COVID-19 vaccines. A checklist of criteria to have in place when considering such evaluation is provided. Objectives of VE evaluations are to evaluate real-world performance of vaccines, to address gaps in evidence from clinical trials, to provide input to impact models, and to provide post-authorization confirmation of effectiveness of conditionally approved products. The most feasible outcomes to evaluate in VE evaluations in the most settings are symptomatic disease and severe disease. VE studies of death, infection, and transmission, while of great public health importance, generally require targeted special studies with more resources.
Estimated that more than 15 billion doses of COVID-19 vaccines are produced every month. 11.3 billion doses are needed to vaccinate 80% of teenagers and adults. Low and middle income countries are barely present in COVID vaccine supply chains, writes Sarah Schiffling, an expert in supply chain management. Diversifying vaccine production, addressing transport, logistic, and training healthcare workers are just some of the challenges to vaccinating those poorer countries. COVID-19 vaccine production has scaled up significantly. Global output is now estimated over 1.5 billion doses a month, rapidly propelling the world towards the 11.3 billion doses needed to vaccinate 80% of teenagers and adults and potentially bring the pandemic to an end. Total output may reach the target by the end of 2021. Protecting the global population will be soon no longer be harmed by limited supply. Yet, despite of production scaling up, for many low and middle income countries, access to vaccines continues to be a struggle. Poorer countries lag far behind richer ones in terms of COVID-19 vaccine coverage. Fewer than 3% of people in low-income countries are fully vaccinated. As of the world closest on having the capacity to theoretically vaccinated everyone, More needs to be done to make sure doses end up being given to those that need them. There's what standing in the way.